This is KGW News at Sunrise.
I had to drop my daughter off Monday, and I have not been able to pick her back up to make sure that they stay safe because I'm afraid.
Healthcare professionals facing a risk every day. They show up to work on the front lines of the coronavirus pandemic. And now we are learning staff at OHSU are among the growing number of cases around Oregon. And while hospital workers are needed on the job more than ever, other businesses are doing their part by closing up shop. But not everyone is following the stay-home order, and officials say they are getting flooded with reports of employers violating guidelines. And sticking with business news, we know a lot of you have questions about your finances as the outbreak sends shockwaves through the economy. So this morning, we are hearing from an expert about what you need to keep in mind if you're getting ready to retire. Good Tuesday morning to you. Thank you for joining us. Yes, it is Tuesday if you are keeping track out there. Good morning, guys.
Hey, good morning, Nina.
If you're keeping track, it's also the final day of March, Brenda and Nina. Of course, this has been the longest March ever. I believe we're up to day 296, if my calendar is correct. So we do have some fun things planned for this final morning of March. Before we get to that, though, Brenda, I know you have another member of our team that you need to introduce us to this morning.
You must be speaking of Rod Hill. He's over in his home weather center with a look at the forecast. Good morning.
Brenda, just do this for me. Give me a holy cow. Holy cow.
Holy cow.
Did you do it? Oh, Matt, that was good. All right. 1 inches of new snow at Timberline Lodge. I know the resorts are closed, but this is huge news for our snowpack in general. 21 inches. Wow. Let's go to Doppler radar. We have it lit up pretty good. The whitish pink tones, that's all snow. Snow level down to about 2,000 feet right now. Fairly dry at this point around the Portland area. We do have that shower activity on the west side, and that's going to be coming in to downtown shortly. We're at 43 degrees. We should open up some breaks today. That'll lead to some rock and roll hail showers and temperatures battling to get up to about 52. And here is Nina.
Excellent. All right, Rod, thank you. Let's start with a look at what's going on in Oregon this morning because this chart is showing quite a spike in cases. Now, this is not unexpected. There are now 606 positive cases and 16 deaths in Oregon. More than 12,800 people have been tested. 95% of them, though, have tested negative. Now, we have learned that 12 of these new people infected are healthcare workers at OHSU. Yesterday at a news conference, one of the respiratory nurses at the hospital said he and many of his coworkers are so worried about getting sick.
While my colleagues and I have been lucky so far, we have no doubt that one of us is going to fall ill very soon.
OHSU's president says they've treated 21 patients with coronavirus, and right now 6 are being hospitalized there. And this morning, the Oregonian is reporting that 18 other healthcare workers at other hospitals in Portland have also tested positive for COVID-19. 10 employees are with Providence Health and 8 others are with Legacy. So as the number of cases rises, there is growing concern about whether hospitals nationwide will have the capacity to treat and save all the sick people. And if they don't, who will they choose who lives and who dies? That very question is at the heart of this letter sent to Governor Brown's office last week. It's from the head of Disability Rights Oregon, and he wants the governor to remind hospitals here that state law prohibits them from refusing life-saving treatment based on a patient's age or a non-life-threatening disability.
Before the full force of this health crisis hits Oregon's hospitals, we really need leadership to make clear that people with disabilities have equal value to other Oregonians.
Now, advocates are raising similar concerns at hospitals across the country. In Washington, a group filed a federal complaint claiming state guidance advises doctors to consider a patient's baseline functional status when rationing care. Oregon has guidance advising its doctors as well. Well, here's a complaint we have heard from many of you over the past week. What do I do if my workplace isn't practicing social distancing or other measures to keep me safe. Well, Oregon's Office of Occupational Safety and Health, otherwise known as OSHA, has heard hundreds of those issues over the past week. And Mike Benner learned they will start doing on-site inspections as early as this week.
The number of complaints into Oregon OSHA is nothing they've ever seen before. Just listen to this. If the agency gets as many complaints this week as it did last week, they'll easily surpass the number of complaints they typically get in a year. That's pretty remarkable if you think about it. And it goes to show you just how serious the idea of exposure to the coronavirus is for people. In the midst of a global pandemic like COVID-19, workplace safety is of the utmost importance. In Oregon, the Office of Occupational Safety and Health is charged with keeping tabs on workplace conditions.
Our jurisdiction is really workplaces and worker exposure. And so what we're trying to do is just do the best job we can to make sure that workplaces are maintaining health and safety of their workspaces.
According to Aaron Corvin, on average, Oregon OSHA receives a little more than 2,000 complaints a year. But listen to this. Last week alone, they received more than 1,100 coronavirus-related complaints.
I would be stunned if there was anything that would come to this scale in recent memory, and even going back probably further than that.
Corvin says a majority of last week's complaints have to do with one of four things: poor social distancing practices, a lack of cleaning supplies for surfaces, a lack of hand washing facilities, or a lack of hand sanitizer.
I think at this point, it's safe to say, it's fair to say that a lot of employers are getting on the right path. When we're talking to them about this.
The compliance officer will always introduce themselves
for complaints that can't be resolved with a phone call. Corvin says Oregon OSHA reserves the right to stop in, unannounced, for an on-site inspection.
If we do an inspection, it would be about identifying whether there are any violations, and if there are, we would issue citations. If they are serious violations, then they would carry a monetary penalty.
Stiff penalties for businesses caught cutting corners during these unprecedented times.
We have a job to do, and we are doing our best, and we're processing these complaints as quickly as we can, and trying to do our best to make sure that the governor's executive order is being followed.
In Washington, there are now more than 5,100 cases statewide. 219 people have died. Clark County alone has 90 cases and 6 deaths. That's according to Johns Hopkins University, which is tracking the numbers around the world in real time. Washington's health department reports at least 65,000 people have been tested in the state, and so far just 7% of the tests are coming back positive. Washington Governor Jay Inslee says not enough people are staying home, and he's considering additional steps to slow the virus, and he pointed to data on infection rates.
There's some very disturbing numbers in that. I'll just mention some of them. In Skagit County, 21% of all the tests came back positive for COVID-19 yesterday or the day before yesterday. In Adams County, it was 19%. In Island County, it was 17%. In Benton County, it was 16%. In Franklin, it was 15%. These numbers are 2 to 3 times higher than what we've experienced in the week or two before.
Governor Inslee also laid out a 3-tiered system to deal with businesses not following the stay-at-home order. The first is a warning. The second could lead to citations and taking away their business license. And that last tier would refer the case to the AG's office for civil or criminal charges. Anyone can report violations at coronavirus.wa.gov. Millions of Americans will get financial help from the $2 trillion emergency stimulus bill Congress passed last week, and it includes a one-time direct payment. Now, to help you figure out how much money you could be qualifying for, text the word check to 503-226-5111. Again, send us a text. Don't call this number. We're going to text you back a link to a stimulus check calculator on our website. Now, it looks like this when you open it. So you scroll down and you're going to answer a couple of questions, like whether you've already filed your taxes for this year, your filing status, your gross income, and if you have any dependents like children. You'll just hit calculate afterwards, and it'll let you know how much money you'll likely be getting from the government. So as we live, work, and play at home, outside businesses keep coming up with creative ways to stay afloat. And now some local movie theaters are letting customers stream independent films at home. The Kiggins Theater in Vancouver launched a virtual cinema, so you can go online and choose one of several independent movies to rent for $12. Kiggins keeps about half the rental cost, and the films get an audience.
I think it's a win-win-win, both for our customers, the distributors, and Kiggins. You know, movies, I think, are important. They're storytelling, and they speak a lot to who we are and who we could be.
The Liberty Theater in Camas is also letting customers stream independent films from home. So is Cinema 21 in Northwest Portland.